Welcome to Healthcare Experience Matters. This podcast is brought to you by the Healthcare Experience Foundation and is dedicated to transforming the healthcare experience so that every person can receive and deliver the best care. We invite you to learn more by visiting healthcareexperience.org. Today we have two very special guests with us. We're going to be talking nurse and physician teamwork. Dr. Anthony Frank joins us. He's the Senior Vice President of Medical Affairs and Chief Medical Officer of UNC Health Blue Ridge. We also have with us Kathleen Lynam. She's Executive Coach and Senior Advisor with the Healthcare Experience Foundation. I want to welcome you both, and I will have Dr. Frank briefly tell us a little bit about yourself and your professional background, and then I'll ask Kathleen to do the same.
Thanks, Casey. I'm Anthony Frank, an emergency physician by training. I've been practicing emergency medicine for going on 24 years now post-residency. Currently in a role now as the Chief Medical Officer for UNC Health Blue Ridge. Prior to that, spent 13 years in academic emergency medicine at a facility on the eastern side of North Carolina. And prior to that, spent 9 years in community emergency medicine practice after I finished my training in Columbia, South Carolina.
Great. And Casey, I'm Kathleen Lynam. As she said, I am a nurse of 35 years in hospital operations, basically grew up in hospitals from a nurse manager to a director to administrator to a chief nurse officer. I retired from that about 12 years ago and doing executive coaching since then. And with that, I've been working with physician leaders, executives, staff around the country for the last 12 years. And one of the reasons I'm privileged to have worked with Dr. Frank in the last 2 years. So happy to be here.
Dr. Frank, this first question will be for you. With your background as an ED medical director and now as CMO, you're in position to discuss this topic with a unique perspective. So what have you observed about teamwork during your ED role versus what you see now with that more eagle-eye view in all different areas of healthcare?
So Casey, as ED medical director of the 24 years that I mentioned, many of those years I've spent directing in EDs from smaller community hospitals to actually in my most recent role was actually directing the ED at a level 1 trauma center. And then, as you say, from the CMO role, definitely similar, but some different perspectives. And all of our healthcare team members are critical to what we do and how we take care of patients. But that really being said, as a physician, there is no more healthcare team member more important to what we do than the nurse. As I like to say, I could be the greatest doctor there is, but without a team of high-functioning nurses, the care really doesn't get delivered to the patient. And in that role, I actually have a couple of brief stories that I had just written down as I was thinking about this question. Remember at a community hospital, it was kind of an unusual case one morning that the outgoing emergency physician had presented this case is pretty much tucked in, and he had made the diagnosis and he knew what was going on with this patient. His instructions, it was an orthopedic case. They needed a knee immobilizer, and the patient could be discharged back to the nursing home. He finished up his charts, and as he was leaving, just said, good luck, have a good shift, and walked out. And probably was 15 or 30 minutes later, the nurse that was now taking care of that patient, who had also changed shifts at the same time I did, walked into the dictation room where I was and said, "Did you get the checkout on this patient?" And I said, "Well, I was told that everything was pretty squared away and that they'd be going back to the nursing home." She had this kind of puzzled look on her face, wasn't necessarily sure to say what to say next. And I said, "What are you worried about?" And she made a couple of comments and had a couple of things that she suggested to me. And I just paused and stopped for a minute and looked at her and I said, "Well, what do you need me to do?" And she said, "I need you to come reassess this patient." And that was a difficult thing for her to say, because I had been handed a patient that was pretty much well tucked in. And now she was essentially asking me to start over. So we both went to the bedside. I said, "You want me to start from the beginning?" She said, "I think that would be best." And we started from the beginning. The patient really couldn't provide much of a history, and we did an exam, and I found those things that the previous doctor had checked out to me. And I looked at her and I said, yes, something else is going on, and why don't we start over? And so we added some lab tests and some other x-rays, and come to find out at the end of this, the reason the patient had fallen and suffered the fracture was that she was septic. And honestly, had that nurse not stopped and had the courage and the relationship and the trust with me to say, I need you to come do this again, we likely would have sent that patient back. I don't know that the patient would have necessarily had a worse outcome, but we definitely would have moved the patient a couple of times, and likely, that patient could have declined at the nursing home and wound up worse off. Again, just an example of what nurses do. And then I was thinking about another one, a patient with hypertension. I was having a lot of trouble in the ED one night, taking care of and kind of stabilizing. And for whatever reason in my mind, I was just convinced that this patient could go home, and continued down that pathway. Finally, at some point, the nurse that was helping me take care of the patient looked at me and said, Doc, why are you trying so hard to send this person home? And I said, that's a great point. And I don't know why I'm trying so hard to send this patient home. Why don't we get him admitted and have one of the hospitalists help us take care of this? So, and I just can't tell you how many times in the emergency department, as one of my final barometers of the care that I'm providing, when I've actually looked at the ED nurse and said, can this patient go home? And to have an ED nurse that looks at me and just kind of laughs in my face and says, are you kidding? And, whether that was what I was thinking or not, just to, kind of have that additional barometer of, am I doing the right thing? Am I on the right track? Because I promise you, those nurses, if they don't think that's the right plan, the ones that I've worked with, have always been willing to tell me that, I wouldn't do it like that. So I just really appreciate that dialogue and the opportunity when they have the ability to, to trust and make those comments.
I love hearing that story. And I think I would love to work with Dr. Frank, because he demonstrates two things that are probably the most important thing for teamwork, and that's trust and respect. So I guarantee you that he trusted and respected those nurses that he just shared the story with, but I bet it was mutual. And in my experience, teamwork varies from department to department to person, and it all goes back to the relationship, whether somebody has confidence in the person that they're working on a team with, has that trust and that respect. The other important thing that Dr. Frank just shared that I just want to shout out is, as the medical director, showing that vulnerability and asking the question, what do you think? And allowing someone to, if you will, giving them permission to say, I don't agree. That's a huge part in building trust and respect for each other. So I think a great answer and great point for those physicians and nurses that work well together. You'll see that kindred respect.
Thanks, Kathleen. I want to ask now a little bit about teamwork. We just saw some nice teamwork on the response to that last question. So let's talk teamwork between physicians and nurses, because we know it has a positive association with patient satisfaction and outcomes. I'm going to start with Dr. Frank. Can you first just elaborate a little bit on why you think that is the case?
On the hospital side of teamwork, really from a safety standpoint, the nurse usually has a lot more of the data points, the knowledge of really the way the patient has been progressing, whether that's for the better or for the worse. And I'm just the, kind of the doctor piece of the puzzle. The nurse at the bedside is seeing, minute to minute, hour to hour changes and trends. And we don't necessarily always have the benefit of that in the decision making that we're doing as the physician. We have a lot of patients that we're caring for. The nurses, also have a number of patients that they're caring for, but they are usually the eyes and ears for the physician. And as they're seeing those patients, they're noticing the subtle changes that we may not perceive from the last time that we've seen them or the last orders that we've placed. One of the interesting things, and Kathleen will probably chuckle a little bit with this one, and some of my more seasoned nurses that I work with currently in my organization have actually reaffirmed this as well. But if you talk to nurses with a number of years of experience, they would tell you as they would see doctors walking into the rooms to see their patients that they were usually right on their heels, because their question would be, what in the world is that doctor doing to my patient? And unfortunately, in healthcare, I'm not sure that is the way that we necessarily teach it now, but it's really an interesting trend, because the nurses of past generations have always been very protective of the patients that they were caring for, and always wanted to know what the doctors were doing. And so I think a lot of areas we can improve is almost getting back to that level of ownership of some of our patients in that team mentality.
I love that answer, and I relate to that answer. I can relate, or I resemble that answer, I guess. I appreciate the advocacy. And I was thinking about this question also, and I thought, okay, so your question was about patient satisfaction and outcomes. How does teamwork impact on it? And when you kind of dive into what matters the most to a patient, it's feeling that they were listened to and cared for. And my observation of that is, if a physician and a nurse are communicating well and demonstrating that respect, like Dr. Frank, I bet, gets managed up by his team. You're in good hands today. You've got Dr. Frank on, and vice versa. That increases the patient's confidence that they made the right decision. They can tell when there's that good communication and that rapport. And therefore, it comes back to, again, that trust and respect. It just sort of impacts it, because when there isn't that trust and respect, you have potential for negative outcomes. So it comes down to, I really believe that the excellent communication between physician and nurses is clearly felt by the patients. They see the rapport and the trust. And I think today, in the recent year, it's probably been a challenge based on not only masks and not only all of the gowns and the protective environment and the restricted visitors, our ability to communicate consistently with each other. But I think everyone is aware of that and making a great effort to continuously provide great communication to our patients, which therefore makes them feel better and more confident in us.
And I would just add, I agree completely with Kathleen that I think probably the most critical skill in that relationship is the trust. And when you have the doctors and nurses aligned, it really is going to improve that experience. In my CMO role, definitely see this a lot of times, that you'll have the nurse that didn't necessarily hear what the plan was when the doctor was in the room. And then you'll have a resident or an attending or somebody else that comes along and gives a totally different plan, or a consultant that says, your family member can go home, and then the attending caring for the patient comes back and says, oh no, we got to keep you for another day for this test or that test, and just when we're not aligned and we're not on the same page, the mixed messages, I think really erodes that trust piece, and it makes it tough for patients and families to feel like we've got it together, and that we're firing in all cylinders. So that piece, just avoiding mixed messages and making sure we're all on the same page before we're communicating with folks.
That leads into my next question about a lack of communication. What are some of the consequences that you both have observed firsthand when there is poor communication or poor teamwork?
I bet Dr. Frank has lots of big picture stories about, we both know the number one cause of errors is breakdown in communication. And I'm going to let him probably tell you the stories about it. Certainly you'll see a higher incidence in errors by omission, by wrong administration of drugs. But from my perspective, you see it in frustrated families. You see it in angry or non-compliant patients when they don't understand, or they have not been communicated clearly, and they don't feel confident in their team. And the other outer effect that I've seen is, guess what? We're losing staff. Nurses in the OR, if they feel that they're not appreciated, not valued in an ER, now people are leaving. This is the year of the Great Resignation. And so teamwork and feeling valued and respected, and that good communication is key for keeping our good staff, for keeping engaged staff. And so it really does have a ripple effect.
Yeah, these are the recipes for the stories that you hear in healthcare, and you really just cringe and say, how did that happen? How in the world could something like that happen in a hospital? Those are that's just the absolute recipe. So injuries, misdiagnosis, avoidable error, lawsuits. We have all the challenges we need on a good day in medicine and in the hospital environment. You throw some poor communication, lack of teamwork on top of that, and that really is just going to be those events that you're just trying to unwind for months and months, and if you're lucky, not getting sued for.
Common barriers to teamwork might include that silo mentality, or a culture where silos tend to take place a lot. Excessive workloads can also be a common barrier to teamwork. So what can be done to overcome these barriers in today's healthcare environment?
So the word that comes to mind really with that question is ownership. I would tell you just that it's amazing the number of mistakes and near misses that I've seen as an emergency physician and as a chief medical officer, just because somebody was not willing to ask the question or say, hey, stop the line. This doesn't seem like, seem right. Whether that's a wrong site surgery, somebody's getting ready to give the wrong medication or the wrong dose of a medicine, or getting ready to do an X-ray or something on the wrong patient. It's really just folks being willing to say, whatever that gut feeling is, or something's not right, or it's tough in healthcare to kind of step up and question each other. I mean, again, from the certain perceived PowerPoints and things like that, it's very difficult. So you have to create the environment where everybody's willing to own it and folks are willing to listen. The other piece of that one is COVID has exhausted everyone. It's really a testament to all the caregivers that we haven't seen more injuries and things during this period of time in healthcare. The intensity and the fatigue it really has taken a toll on the system and the people, just because if you're doing this right, you just can't let your guard down, regardless of how tired and how fatigued you are. And as Kathleen mentioned, you're seeing lots of folks leaving healthcare, and I would argue that it has a lot to do with that. That this is not a job that you can just kind of do halfway. I mean, you're either all in and watching every minute, or you're not. And I think that's what you're seeing with a lot of these frontline healthcare workers these days, is that the toll from that intensity and level of awareness has just finally worn them to where they can't do it anymore.
So true. And when I think about silos, I think silos go away when people see or walk in other people's shoes. And, when, the fact that Dr. Frank is willing to lift up and recognize the value of nursing, the value of respiratory therapists, the value of physical therapists, I think when we all begin to recognize we can't do it without each other and work on that in a more formal way, whether it's interdepartmental joint meetings, leaders standing up and managing up, somebody from housekeeping or from food and nutrition services, and start formally and publicly acknowledging that it takes everyone. And we appreciate what you do, even though, we don't see what you're doing every day. I think we saw a lot of that with COVID. I mean, from what I've heard around the country, and perhaps Dr. Frank can comment on that, they only have each other since staffing has been challenged. You just have the people you're there with every day, and all of a sudden appreciation for the housekeeper who's in there hustling to turn that room around really quickly, or somebody's running down to the cafeteria to get somebody food. When we do that and make that effort, and especially from a leadership point of view, when we do that, then all of a sudden there begins to be less of those silos and more understanding of we need each other.
Really well said. I appreciate the thorough responses there from both of you. Now I'm going to ask the most salient question of all. How can nurse-physician teamwork be improved? And Dr. Frank, I'll let you take it first.
So I think I would probably take this one and really piggyback on what Kathleen said. And a lot of that, especially with the COVID and the way the teams are feeling these days, I think it just being there for each other and seeing each other as equals in the way of all of us have a job to do, and that job, as Kathleen is mentioning, whether you're the person that is cleaning that room for the next patient, the fact that that room has been sterilized and that there's no bacteria, waiting around for the next patient, how is that any less important than what I'm going to do as the doctor to take care of you, or how the nurse is going to take care of you? So just realizing that, that we all have different jobs to do, and they're all just as important. They may not, be, quite as highly scientific, but they're just as important. And really avoiding the hierarchy that has been there in medicine for years, that, you're just a nurse, or you're just a tech, or, using language, or, even that thought process of maintaining some type of hierarchy. Saying hello to each other, and finding out what makes each other tick, and those kinds of things. I think just the human interaction is just really important. And for those of us in healthcare, I mean, you would maybe look at us and say, well, this pandemic has been just terrible, and you guys have been unlucky, and I don't know how you do it. I would tell you, in one sense, we've actually been lucky, because throughout the pandemic, I've been able to come to work, and I've got other human beings that I've been able to interact with, whether that's, other senior leaders, administrative assistants, directors, nurses, EVS, whoever it happens to be. I've been lucky. I've not been isolated at home. I've had a lot of human interaction during this period of time. And, I think that is probably why a lot of folks continue to show up and do that every day.
Good answer. And what I was thinking about this, and I think it goes back to the first question about trust, the relationship. It's about relationships, right? In order to improve teamwork, it's about relationships. And, there's a couple of things that research have been done, and one of them I love. And I would encourage, when you think about improving teamwork, I think we said this right from the beginning, it varies in every different department of the hospital. It's going to be different in the ED when Dr. Frank's there versus in an OR when it's a cranky person, or in a new nurse, and different on the med surg unit with the hospitalists who are changing. So one of the things that, that we can do is kind of get to know each other as a person. So one of the things, one of the ideas I thought was great, creating the bulletin board with fact sheets about us, the staff on the one unit, and the physicians that work on that unit. So you find commonality there. We know our patients want to know about us, and, know that we connect with them as human beings. Well, it's the same thing as nurses and docs. The second important thing that we don't do enough of, and I'm an old orthopedic nurse, so I was invited to every orthopedic meeting. We set up our first joint center. Collaborative practice is key. That's where docs start to say, oh, she knows her stuff, and nurses start to say, oh, he's a smart one. I want to work with this one, and start encouraging collaborative practice. And the third thing, I think, which I don't think we've done enough of, maybe down where it's warmer in North Carolina, anything to create team outside. When you get somebody outside of their unit and you start talking about a softball, volleyball, bowling, I don't know, crafting, I don't do any of that stuff, but swimming, down in North Carolina, boating, any kind of thing that you can do socially to encourage those relationships, I think will help all of us in improving teamwork.
Dr. Frank, back to you. I want to ask if you have any other general feedback on how nurses and doctors can work well together, or if you have any other final thoughts before we work towards wrapping up here.
So I believe, we've just got to be a team. As physicians, we know the medicine, we know the science. The piece of that, though, the nurse knows the patient and the family, and they're really the key to the ultimate experience that folks have when they're seeking healthcare. The competence of the medicine is kind of assumed in healthcare, but it's really that extra piece that we're able to deliver. And I think that's, where the difference can really be made. And I think I mentioned earlier, nurses really are the physician's eyes and ears. Another quick story that I would just tell you, back in my previous position when I was running a chest pain observation unit, when I was actually the attending rounding in that particular unit, the first thing that I would do when I arrived would be print the patient list so I knew who everybody was. And the second one was sit down with the charge nurse of the unit and basically run through those patients with either him or her, depending on who was there. The amount of time that this saved me and the avoided missteps was just amazing every time I would do this, because again, they had the benefit of rounding with the night team of nurses who knew what that patient had done overnight. They had already assessed those patients and kind of the family dynamic and had that information. And when I sat down, the story would be, patient, Miss Jones in room number 1 is going for a stress test. Everything looks good. She's ready to go home. If it's negative, room 2, oh my goodness, when you walk in there, you need to know that the daughter last night was mad about this. And I mean, so the ability to be able to head off things and just be well prepared as you were walking in to take care of patients and interact with their family members was just amazing when you did it like that. If you for some reason chose to not do it in that order, it usually took you about twice as long. Just another point there.
I love that story, Dr. Frank. That's perfect. And my comments when I thought about this, and I think Dr. Frank in his role is a good example. Whatever your role is, if you're a leader, whether you're a supervisor, a nurse manager, PG2, you're a medical director. As a leader, you're one of two things, a light at the end of the tunnel, or you're a oncoming train. And people are either going to be drawn to you and look to you as a role model, or they're going to be running to get out of your way. And so I would guarantee Dr. Frank makes rounds with the CNO and, does a job there of showing collaboration and teamwork and managing each other up. And I always encourage nurse managers, find your docs, round with them, manage each other up, be a role model about teamwork and encourage it and help each other build those relationships, because I think that's what we need to do as leaders in our healthcare today, is be role models for everyone else, because it's amazing the shadow that we cast.
And Dr. Frank, I'll just turn the mic over to you for the final word.
Thanks for that. I would tell you that nurses are my favorite members of the healthcare team. It absolutely inspires me and is amazing to me what they do for each other and patients and other human beings. It really does inspire me to be a better physician every day. I think they're typically underpaid and certainly underappreciated for the role that they have in healthcare. And in the COVID pandemic and the aftermath of that, I believe as an administrative team and as healthcare systems, we're really currently seeing how important they are to this work and to the experience. And just it's critical for us to make sure that we're taking care of them and making sure that we're taking care of each other as we do it. Thanks for the opportunity.
Ladies and gentlemen, you've been listening to Dr. Anthony Frank. He is Senior Vice President of Medical Affairs and Chief Medical Officer of UNC Health Blue Ridge in North Carolina. And Kathleen Lynam, she is an executive coach and senior advisor here at the Healthcare Experience Foundation. Very special episode, and I thank them both so much for their time. Thank you for listening to today's episode of Healthcare Experience Matters. Healthcare Experience Matters is brought to you by the Healthcare Experience Foundation. To learn more, please visit healthcareexperience.org. That's healthcareexperience.org.